Swadika. Hello, my name is Nam from the Red Cross Society, and I'm joined by two of my colleagues, Proud and JJ. Having seen and done research on the mental health challenges among Thai youth, we decided to work on the mental health and psychosocial support. Our project, YouDee meaning well-being in Thai, aims to actively challenge this issue through innovative and impactful media. Over the past phase, we have practiced the skills from the academy workshops and have created a prototype of 25 mental health and self-care kits for youth called Care Boxes. Besides, we have also launched a webinar and built awareness reaching over 3,500 individuals across all social platforms that we have, including Facebook, Instagram, and our own website. Recently, we have had the opportunity to share the gain insights on an international stage as well. To become constantly inspired, we started building a solid foundation by understanding what we are going to tackle through research, interviews, surveys, and consultation with a psychologist. We then established our problem statement, set priorities, and created a persona to better understand our target group. Afterwards, we evaluated our capabilities and recruited 10 more volunteers to suit our vision.
Our project is run by Youth for Youth. We are helping to increase accessibility to useful materials and information through interactive and outreach means. To do so, we've established a systematic and feedback-driven environment through weekly sessions for our project and discussion and updates using the Doing, Done, Need Support framework. Plus, we utilize many tools such as Gantt chart and publishing plan to help keep our project on track. During the ideation phase, we use Slack for more organized conversation and Miro, which is a platform that helps us analyze problems, brainstorm our different ideas, and select our solutions. For the past 3 months, we tested 3 of our flagship projects. 1, How to Be a Good Advisor webinar. 2, our Carebox and Booklet project. And number 3, online articles and social media engagement.
We put all of them to test and collected feedback for future improvements. For the online articles, we used statistics to evaluate youth impression and interactions. For the webinar, we collaborated with the Center for Psychological Wellness, Chulalongkorn University. It was very well received, and we collected feedback from over 82 participants. For the care boxes, we constantly reviewed them with a psychologist before sending the prototypes to 10 individuals for testing. More than that, we were delighted to share our experience at the Asia Pacific Youth Network gathering and inspired many to start taking actions in the field of mental health. Now let's talk about our findings and learnings. But first, we have to acknowledge that mental health, especially among youth, is a sensitive topic that differs greatly from person to person and from community to community. So being open-minded and constantly improving was one of the most important things we did. First, we recognized that some of our article content that was more academic and research-based were less appealing to younger generations. Therefore, we shifted to create more friendly and accessible mediums. This translated to our other initiatives, such as designing the webinar workshop and also co-creating the self-discovery booklet.
Another point that we have to acknowledge is that mental well-being could start from simple things such as knowing what they are good at or what makes them unique. This has become the main idea behind our Carebox project, the project that we want to help youth become more self-aware. And for expanding our project in the future, we want to focus on making our solutions more accessible and user-oriented. Through making adjustments to the feedback we've received during this phase, we hope to be able to expand our reach into the diverse demographics using an intersectional approach.
And if we were to receive further funding, we want to do 2 things. Firstly, broaden our impact through increasing accessibility, such as turning our booklet into an interactive website or translating them into traditional dialects to reach larger, more diverse, and more vulnerable groups of youth here in Thailand. Secondly, we want to build community. In this phase, we've grown our team to encompass over 13 youth volunteers and collaborated with both academic and public organizations, as well as mental health professionals. We hope to be able to expand this community of change makers in the near future. And with that, we are more than confident that the YouDee Project can bring about positive changes in the mental health of Thai youth, one small step at a time. Thank you very much.